on a serious note, I think some of the projects that pharma have been involved in, I don't believe they've actually created an issue. I think if anything, in the short term, they've enhanced patient care. That there are some that haven't because they failed, and there are some that have and have been very successful. And the ones that have been very successful, where the outcome from those projects have been published and have been rigorously discussed, they clearly show that in a locality, by collaborating, you can improve the care for patients and I'm talking largely in asthma, but I've seen it happen in diabetes and also in cardiovascular. And that's largely where you've got true joint working, where there's no money changing hands. It's not sponsorship. It's where you've got industry bringing an aspect of expertise that the local NHS team don't have. And the one area that I'm very passionate about is around data, because the NHS sits on one of the biggest data sets in respiratory disease, as I'm sure you know, given your commercial venture, but we do very little with it. And we don't do enough with it because we don't have access to it. And this is why I keep talking about governance, because if you get the governance right, you can collaborate with industry and you can get something very powerful for patients. And the NHS is sat on some of the best data sets, and we'd love to work in an open and transparent way to demonstrate the value of those medicines.
As a society, we're going to be having another 20, 30 years debate about the ethics around data in every aspect of our lives, and health data is no different. And so one of the things we get really cross about is somebody saying, can charities please help us with a campaign to get patients to accept data? Because it's a bit like saying, can everybody have a campaign to say, whatever Google does, however it changes it for the next 30 years, that's okay, we'll just decide once, will we? And it's going to be a long-term ethical dialogue. You know, public health budgets are being cut all over the place. And in respiratory, we should think, and pollution is an obvious area, we should think about, well, where actually do commercial organisations have assets that we could use to help tackle some of those root cause problems in a budget that has been slashed?